Today, we will be doing another webinar with Dr. Khoa Nguyen at Forestwood Dental. Please hold any additional questions until the end of the webinar. Thank you.
So what are the unique options for whitening my teeth?
The most simple one that is most effective is if you were to do it at home with a custom-made tray. The custom-made tray allows you to apply the gel onto your teeth and keep it there without it washing away. You're able to purchase concentrations in gel starting from 10% up to 35%. And the percentage of the whitening gel dictates how strong it is and how long you need to leave it onto your teeth. Of course, the 10% usually is something that you would wear and go to sleep in for 8 hours. Then you can scale all the way up to 35%, where you only leave it on your teeth for 15 minutes. It's just not the most ideal thing, especially when you're not around by a sink. The other formulation that's available for people who are on the go is a pen application or a strip application. Pen application, those applications, like I said, it only comes in 10%. It works well for maintenance, but if you're trying to get brighter teeth, it might take too long. The other option that I've seen is a preloaded strip or a preloaded moldable tray that you can press against your teeth. And the gel on those products tend to be a little higher than the pen. So you do get much better results with that. The ones I've seen is by Colgate strips. They do work. It's just applying the strips to the teeth can take a little bit of time. The other product that I've seen where they have preloaded trays is the ones that you can purchase professionally at the dental office. Now, the last option for whitening is the most powerful version, and that is the 38%. So 35% is the highest concentration that you can do at home unsupervised. You do require to protect your gums, your lips, your cheeks, your tongue during the bleaching process. And so those tend to be the in-office whitening sessions. And what that comprises is 4 15-minute sessions of 38% while your gums and everything is being covered up. And after the 4 sessions, we kind of remove all the gel and we apply immediately a fluoride treatment. So a lot of times that tends to be the fastest result, of course. So if you need a photo shoot the next day or in 2 days, then that is really your only option. And you do fit in almost maybe 2 weeks worth of bleaching of your teeth in one session. And it will continue to actually whiten. And what a lot of times that we have a lot of patients, they will do that, the in-office session, just to cut down on their at-home bleaching time.
So how do I combat bad breath?
All right, so bad breath, that actually is a cause of certain bacteria that's inside the mouth. So the tongue is got a lot of surface area that is being used for taste. And in those areas, the bacteria that mostly cause bad breath is where it hides. And so it's very important that when brushing your teeth that you also scrub your tongue very well. Mouth rinses do help. However, you have to physically scrub in order to really break apart the bacteria more effectively. And if you scrub first and then use a mouth rinse afterwards, that really does help take care of the bad breath. That's one area where bad breath comes from. The other area where bad breath can come from as well is if you have an infection of a tooth, gum disease infection, because gum disease infection of a tooth can really cause bad breath as well. And most patients who have that situation they themselves don't even know where the bad breath is coming from, and an actual infection from a tooth, or we just need to scrub your tongue and apply any kind of mouth rinse will work.
Right. So what can I do if I have a dry mouth?
All right. So dry mouth. The one unfortunate news about dry mouth is that it is mostly related to the medications that you're having to take for to maintain your health. And so you kind of can't get off of those medications. But a lot of patients that do have dry mouth, what they have found to have helped them to actually try all of the dry mouth medications. Now, there could be 14 or 15 brands out there, but the key is not just to try one and quit, because you might try the most popular one out there, which is Biotin. That's a very popular brand, but it just doesn't work for you, or you just not comfortable using it. Then it doesn't mean that all of the other dry mouth medications are not going to work for you. Each company addresses dry mouth in a different way. They come in multiple forms. So one is a liquid bottle that the best way to use the liquid dry mouth rinses is not by swishing and spitting, but actually by putting it into a spray bottle, and then you would spray inside your mouth. And when you do that, it it creates a nice coat inside the mouth very evenly. And that tends to be the easiest way of going about just spraying, just to maintain the moisture. There is another company where they developed, it's called a lozenge, but a lozenge is just pretty much a piece of candy that has medication in it. And that lozenge actually can be placed against your gums underneath your lip, somewhere in the back. And when you tuck that piece of lozenge back there, it naturally will create saliva, in a sense that it'll cause you to salivate more. And a lot of people find relief with that one, especially when they don't have, they're just having dry mouth at night when they're going to sleep. And you can't just have a piece of candy in your mouth, because then you might swallow it. But with the lozenge, because you're able to tuck it underneath your lip and actually it will stick to your gums and lip, you're not having to be afraid of it falling to the back of your throat. It will stay exactly where you place it, and it'll cause you to salivate more. So that product is available. I can always link to, put a link on it, but it's called Xylem Melt with a XYL Melt, and you can check that out. Now, the last type of medication that can help with dry mouth is actually pills. There are types of pills that you can take that can stimulate your body to produce more saliva. But those pills, it doesn't just produce more saliva, it also actually produce more sweating and more tears. So your sweat glands, your tear glands, and your salivary glands are all interconnected quite much. And so when you stimulate one, you do stimulate all, unfortunately. However, there are people who have conditions where that tends to be the best one for them. And so it's really hard to say which one you should use. You just got to try them all. And really, we tend to not prescribe them any kind of medication. We tend to prefer that our patients try all the over-the-counter medications first, prior to us resorting to actual medication to help stimulate the saliva.
So, next question. Where should I go if I have a dental emergency and I can't get a hold of Forestwood Dental?
True dental emergency for us is something that is life threatening. Now, what can be life threatening in a dental setting? So, If ever while if you're having pain, and the first sign that you need to be careful of is when you open your mouth wide, you're not able to open wide. You're only able to open your mouth a little bit. So you have restricted opening. That's one of the first signs of a bad dental infection. And if this dental infection were to progress from limited opening, it would then lead to difficulty swallowing. So the infection can start to create some swelling, and it can start to press on the esophagus of the person, which then starts making it very difficult to swallow. Now, if the infection gets even worse to what we consider to be a dangerous level, the swelling will be so bad that not only is it pressing on the esophagus, it's now also pressing on the airway. And so you'll have difficulty opening, then difficulty swallowing, and then worst case scenario, you start having difficulty breathing. If ever you start having any of those symptoms, you need to call emergency room, 911, urgent care, any of those, because you will need urgent treatment. You need to get on antibiotics as soon as possible, shut down that inflammation and that swelling. So if you're not able to reach us and you start to have any of those symptoms, you gotta call the emergency room so that they can see you and potentially get you on antibiotics as soon as possible so that it doesn't become an issue. Now, if you are having pain, however, you're not having any of those three symptoms, then it's not, thankfully, a life-threatening situation. You might be in a lot of pain. And so I would encourage you to try to find another dental office so that they can see you immediately. It might require that they need to do an emergency root canal to get you out of pain. And sometimes the pain might just be because you're biting a little heavy on the tooth. There's extra forces, and that might be something that we just need to adjust the tooth a little bit just to get you some comfort there. So it varies. If it's the latter, which is uncomfortable bite or potentially the root canal or the extraction, then you can most definitely just take pain meds to get yourself over the situation until you can reach us, or absolutely call a local dental office to have them help you with that. But so long as it's not an emergency, which is those three things, you are okay to wait.